bureaucracy in particular, rather than finance, rather than staffing. I just wondered what your views were on that in terms of Scotland's NHS. And also, just going back to James's question, when he was on LBC this morning, he accused your government and the UK government of using the GRR bill as a devolution, a constitutional political football, and that this is not a political matter, but in fact a legal one if there's going to be a challenge. I wondered if you
I don't really have anything to add on the GRR point, in addition to what I said to James earlier on, except to say, you know, it's only becoming a constitutional issue because we've got Westminster politicians refusing to accept the right of the Scottish Parliament to legislate in an area of its own competence and making unwarranted and completely unjustified threats to challenge that legislation. So if anybody's trying to use it politically, it's those Westminster politicians. The Scottish Parliament, including Keir Starmer's own party, with one or two exceptions, voted for that bill. You know, one of the amendments that puts on the face of the bill, to put it beyond doubt that it doesn't affect the Equality Act, came from a Labour or originated with a Labour MSP. So those comments to from Keir Starmer, he needs to understand that this is not simply a proposal that's been passed by the SNP. This is a piece of legislation that's been passed by the Scottish Parliament by a significant majority, MSPs across all parties, and the vast majority of MSPs in his own party. And I think he needs to reflect very seriously on that. As to his comments on the NHS, I found his comments yesterday pretty dispiriting, to be perfectly frank. Yes, and we talk a lot about this, the reforming of patient pathways and how care is delivered in the NHS. That is underway in Scotland and will continue. The See and Treat, Hear and Treat initiatives, Hospital at Home that I've spoken about, the shift to primary care, multidisciplinary teams in primary care settings, all of that is important. I think some of what he was saying yesterday was, you know, quite dangerous in respects, and some of the advice he might have been giving to people with potentially very serious conditions not to go to their GP or to look for ways to bypass their GPs. But I'll not say any more about that because he may have not intended to say exactly what he did. But I think what people in the UK, across the UK, probably want to hear from the Leader of the Opposition at UK level, somebody who is aspiring to be Prime Minister over the next couple of years, is a commitment to invest more in the health service. Would be a commitment to reverse Brexit so that some of the recruitment challenges that are being exacerbated by the loss of freedom of movement can be overcome. You know, we're investing to the maximum that we can in NHS Scotland. We're asking those who earn most to pay a bit more tax using our income tax powers. So we're doing what we can to maximise the investment going to the NHS, but to go beyond that, we need to see a UK government that actually lifts the level of investment in the NHS. That's a point I was making to the Prime Minister when I saw him last Thursday evening. I don't have very much hope that a Tory government is going to do that, but surely people would expect to hear from the Labour leader aspiring to replace a Tory government actual commitments to significant additional investment in the NHS. And for there to be a complete lack of that, I think most people, not just me, will find that really dispiriting at a time when people hope to hear more and better from a Labour leader. And I say again, you know, Keir Starmer needs to stop trying to be a pale imitation of the Tory government he's seeking to replace and actually start offering some positive alternative. Neil Pooran from PA.
Thanks, First Minister. In terms of your plans to discharge hospital patients into care homes, which you spoke about last week, can you first of all confirm how many and how many cases that's taken place within the last week? And also, have there been any reports of increased infections in care homes as a result of this? This is something that care home relatives in Scotland have been concerned about, as it would mean that the care homes shut down to them visiting the relatives.
I'll ask the Health Secretary and the Chief Medical Officer to add, but obviously infection is monitored in care homes as it is in hospitals, and infection control processes and procedures remain important. Obviously the guidance to implement the commitment and the announcement that was made last week was issued, and that is work in progress. We will start to see the figures coming to the Resilience Committee this week to show progress, and of course we'll look to see how and in what form we can share that with you. The additional beds, though, that we announced the commitment to fund last week is on top of 600 beds that are being used for interim care already in care homes. So again, this is not something that is completely new. This is something that has been used to help with current pressures in recent times, and last week's announcement builds on.
Yeah, thanks so much. Very little to add to that. I just think it's just worth reiterating the point that I made last week that, of course, those numbers of delayed discharges are not a static number. People are constantly coming in and out of the system and being discharged, and the vast majority, over 95%, being discharged actually on time. So we have really well-established procedures when it comes to discharge into a care home, whether that's an interim place, of which the First Minister's right, there's already 600 beds being used, or of course whether that's on a permanent basis. So we have really good infection prevention control measures in place. We were up front last week in saying, and I was up front in saying throughout the week, that the high levels of flu we were seeing and COVID, for example, may well mean that some care homes will have to restrict their admissions, not stop them altogether, but restrict their admissions, and that may slow progress in terms of the numbers we're looking to discharge. But the good news on that, of course, is that flu and COVID vaccination rates in our care homes are exceptionally high amongst residents.
Gregor.
Neil, what we've been doing over the last few weeks in the lead up certainly to the festive period is keeping a very close eye on the number of outbreaks that we're seeing in care homes, and they come about for a variety of different reasons. It's not just flu and COVID, but other infectious pressures such as norovirus as well. So monitoring all those and seeing exactly where that picture is developing. And in the run-up through December, we were beginning to see those outbreaks becoming more apparent, the numbers increasing through the festive period. At that point, they were beginning to kind of crest and peak. And of course, these are a reflection of the disease burden that there is in the community. There's a direct correlation between how much infection you have within communities, and therefore how likely it is that those are then likely to be passed on into care homes. We're now seeing that picture beginning to stabilise as some of the community pressures in terms of infection are beginning to stabilise as well. We continue to keep a close eye on it, obviously, but at this moment it appears to be a stabilising picture.
Mark McLaughlin from The Times.
Morning, First Minister. Has there been any impact of the teacher strikes on NHS staffing, securing part-time staff, agency staff, or even full-time staff having to take time off to care for children?
I am not aware that that is the case in any meaningful sense, but I'll ask Councillor.
No, exactly that, First Minister. We get the absence figures for NHS staff every single week, and look at last week's figures. It generally followed the trend that we saw in terms of viral infections. I'll get this week's figures later on this week, but I'm not anticipating, certainly from the feedback and the engagement that I've had with health boards up and down the country, it's not a significant factor in a meaningful sense.
Joseph Anderson from The Scotsman.
Thank you, First Minister. After you announced funding to free up community beds at last week's briefing, the Royal College of Nursing and Scottish Care expressed concerns about the plan, saying they're unlikely to work without addressing vacancies and staffing levels. But how can you make a career in the NHS attractive if you won't even pay them what they feel they deserve?
Well, we in Scotland, of course, are already offering a pay rise this year that is significantly above what has been offered elsewhere in the UK. That is a pay rise on top of NHS pay that on average is already higher than in the rest of the UK, and that differential will grow. And we are now negotiating intensively, or about to be negotiating intensively, about next year's pay rise. And you'll have seen some of the latest developments at the end of last week, which means, and as I said last week, I'm not complacent about this at all, but we remain the only part of the UK that hasn't seen NHS workers going in strike, which I think is an indication of the fact, A, that we do value NHS workers and want to pay them as much as we can within the resources we've got, and that while NHS trade unions are always very robust in arguing the interests of their members, there is an ability to sit down around a table and negotiate with them, and we'll continue to take that forward. On the point about care home beds, I mean, this is about interim care to help speed up discharge from hospital and reduce delayed discharges. It's not the overall single solution to the pressures that the NHS is facing. And of course, what we're talking about here are available staffed care home beds, and that is important. Beds that are already staffed but not currently occupied. Do you want to add anything?
The only thing I'd add is that's one of the reasons why we agreed the funding to be able to cover above 25% above the National Care Home contract, because it was coming back, feedback from Scottish Care, for example, and others who sit in our ministerial advisory group, that although the First Minister is absolutely right, we're looking at staffed beds, the way to help with that in the interim, with interim care beds, might be that we have to pay above and beyond the National Care Home contract rate. So that is one of the reasons why the funding that was announced last week allows us to be able to do that, but nothing to add further to that.
Okay, thanks. My list now says Simon Johnson from the Telegraph, but I'm also not seeing Simon, I don't think. Nope. In that case, I'll go to Chris Green from The Independent.
Thanks, First Minister. Just another figure question. I think last week you gave the figures on the level of delayed discharge as 1,700 patients. I just wondered if there was an update this week on that. And also, can we expect any further action to be announced in terms of a ministerial statement or anything this week?
Firstly, on delayed discharge, I mean, obviously we publish official statistics periodically on delayed discharge, so what I'm citing right now is management figures, and remember, it's a really obvious point, but I think it is one that is always worth pointing out. The delayed discharge figure is not a static figure, it reflects admissions and discharges, so the figure is probably broadly, I think at the moment, similar to what it was last week, but of course we continue to try to get it down to speed up the discharge of those who are technically defined as delayed discharges, but the initiative I spoke about in my opening remarks of asking all health boards to review all discharge plans right now to see if we can ensure that even people who are perhaps not meeting the definition of a delayed discharge but might have a barrier to their discharge, that work has been done to reduce that as well. Okay. Lukanya Mianda from the Financial Times.
Thank you, First Minister. If I may go back on the gender reform bill, I just want to check, in the event that the UK government does act to block it, what would your options be? How will you react? What will you actually do about it? And then secondly, I'm just wondering, is the fact that you're having these press conferences, is it a sign that politically, like you have some evidence that maybe the negative headlines about the NHS are hurting the SNP?
On the last point, no, and you can read polling evidence as well as I can, so I'm not in receipt of any information that you don't already have. I'm trying to be accessible to the media. If we weren't, no doubt we'd be getting questions about why not. So I think on these kind of things, it's damned if you do, damned if you don't. So I, as I did during the pandemic, try to be open to your questions and to your scrutiny, and I think it's an important thing to do. On the GRR point, I'm not going to repeat everything I've already said there, but we will vigorously defend the legislation. Depending on if there is a challenge, and I hope there won't be, but the indications would suggest that that may be what we are looking at. It will depend what route to that the UK government takes. If it's a Section 33 challenge, then that will go to the Supreme Court, as I understand it, and we will defend the bill in the Supreme Court. If it's a Section 35 challenge, that would require, I think, the Scottish Government to judicially review that decision. But these are technicalities. What I can say in general is that we will absolutely, robustly and rigorously and with a very, very, very high degree of confidence defend the legislation. Kate Foster from the Daily Mail.
Minister, given the pressures on A&E in hospitals just now, if there was to be a major incident in Scotland, such as a bus crash or a train crash, would A&E departments in hospitals be able to respond to that and give the appropriate care to patients? What are the contingency measures for that?
Yes, they would, and we have a high degree of confidence in our NHS to respond to major incidents, and that is demonstrated on the sad occasions when we have major incidents. All health boards will have contingency plans in place for a variety of eventualities. Rachel Watson from The Sun.
Thank you, First Minister. I just want to ask about school strikes again. We know following lockdown about the concerns around mental health, education and social skills of children, the concerns that are around there. Education has now been disrupted again by the strikes. Are you concerned about the impact this is having on children? And yesterday the EIS called for you to show the same urgency to getting a pay resolution with teachers as you have the NHS. Are you going to step in?
I always get slightly, I reflect on questions about me stepping in. I never step out of government. I'm always involved in these issues. Of course, I'm concerned about industrial action in our schools because I don't want to see that impact on young people and I don't want to see teachers having to take industrial action. I think what we have demonstrated, particularly or most recently, it's not the only example, but most recently in the NHS, is that we are not a government that simply digs our heels in industrial disputes. We are a government that seeks to find resolutions to disputes, a government that tries to treat public sector workers as fairly as we possibly can, to maximise pay increases within the resources we've got and to avoid industrial action. And we stand ready, willing, and there are have been talks last week and they will continue to do that with teachers as well. But as we also see in the NHS, it does involve compromise on both sides. And therefore, I hope we will see that compromise on both sides. And remember, unlike the NHS, COSLA is a partner in teacher pay negotiations. And I hope we will see that compromise that gets to a resolution. But we are not, and I think this is well evidenced, we're not a government that simply digs our heels in and refuses to talk to trade unions. And lastly, Louise Wilson from Holyrood.
Morning, First Minister. I just want to ask quickly on the legislation that the UK government are putting through about strikes and minimum service levels. You've already said that you're against that legislation. I was wondering if you would refuse to cooperate on enforcement of that, much like you did with the trade union bill in 2015-16, if that were to pass.
We will certainly not be a willing implementer of any trade union legislation of that nature. I had a discussion with the Prime Minister about this last Thursday when I saw him. Now, it depends, the ability of the Scottish Government to do different things will depend on the framing of not just the primary legislation, which is very, very vague in the details that it includes, but the secondary legislation. In my view, that bill, given employment law is reserved, unfortunately, and I regrettably accept that right now is the reality, but the implementation of legislation like this, if you look at the sectors that are supposed to be covered by it, with one or possibly two exceptions, are devolved services. So deciding whether a minimum level of service is required and what that should be would be down to devolved services. So my view is that the legislation, well, legislation shouldn't happen, take that as read, but if the government is intent on going forward with it, they should not apply it to Scotland, but if they do apply it to Scotland, they should give the power to Scottish ministers to decide whether or not to implement it in the sectors affected. So I made those points strongly to the Prime Minister, and we'll see what the response is in coming weeks and months. Any final comments, Gregor?
No, nothing to add.
Okay, in that case, thank you all very much for your time.